Morning, everybody. I'm Ed Haynes. I'm the PathSafe Science Fellow, and I'm going to give a brief overview of the PathSafe programme. I don't think I'm going to take the full 15 minutes on the slot, so hopefully that will mean we have a bit more time, as Robin was saying, for some of the more in-depth talks about the various projects. I'm also very aware that a lot of people in this room are going to be extremely familiar with PathSafe, been involved in it for a long time, but there are people who are a bit less familiar or perhaps new to the programme, so it's still worth, I think, giving a bit of an overview just to put the talks that we're going to hear about over the next 2 days into a bit of context. The overall aim of the PathSafe programme was to pilot a better national surveillance system for monitoring both foodborne pathogens and AMR in the agri-food system. It's a shared outcomes funded programme of work which is cross-departmental and 4 nations of the UK by design. And as it says there, originally ran from 2021 until 2024, and now we've had the great news that we've got a continuation. But when we started in 2021, this was before so many of the programmes and initiatives and strategies that we're all familiar with were in existence or were in their current form. So we were in a very different biosurveillance landscape when we first started and first came into existence. And PathSafe's really been at the heart of that landscape, engaging with and supporting various different programmes and initiatives. And we should be hearing later on today from some of those complementary initiatives in PathSafe. So the programme overall has been split into 4 different work streams. So all the projects that you're going to hear about over the next 2 days would sit within one of those 4 work streams. And at a very high level, the overall aims of these were for work stream 1, primarily to create a data system to enable the analysis and sharing of pathogen, genome and other data among government partners. Workstream 2 was focused on piloting different surveillance methodologies for both foodborne pathogens and AMR in the agri-food system. Workstream 3 focused on evaluating and piloting on-site diagnostic technologies. And Workstream 4 was looking at antimicrobial resistance in the broader environment as a whole. And the programme initially started as a collaboration among the departments and agencies that are listed on the bottom of the slide. These were the core partners that went into the original proposal, PathSafe funding, but the partner landscape has really grown tremendously since then. We still have the core government partners, and we've also got additional government agencies that are delivering really critical parts of the programme. We've got a range of different academic partners who are working on different projects in the programme, and we've got industry involvement as well. And the projects that you can hear about are really nice examples of collaboration between these various different sectors. But as well as cross-sector representation, as a programme, we've worked really hard to ensure that we have nation approach both at the delivery level, so we've got delivery partners in each of the 4 nations, also at strategic level. So on the, for example, on the PathSafe board, strategic board, we've got representation from all. Really glad to approach this kind of who PathSafe is. When we were thinking about how to give an overview of PathSafe without going into a lot of detail about all of the projects that have been ongoing, because that's what we're going to hear about throughout the course of the conference, we thought one way to give that kind of context to what PathSafe's been trying to achieve would be to focus on the PathSafe theory of change. This was developed by RAND, who we're going to hear from at the conference, but with collaboration and input from all the PathSafe partners. And this really describes how we were hoping we would go from the various inputs and resources that we started the programme with to the impacts that we hope the programme would have over the kind of medium to longer term. I don't expect you to be able to read all of this, but if you're interested in looking at the details, this is on a poster that you can go and look at in the poster zone during one of the breaks, and feel free to have a look at it at your leisure. So I'm not going to have the time to go into all of this. I'm not going to talk about the activities and outputs, because I think that's going to be the focus of all of the talk here, is exactly what people have been doing and what they've found out. We're also not going to talk about the impacts, because RAND will be presenting some preliminary results from their impact feasibility assessment tomorrow. But I think to set the scene for the talks that we're going to hear at the conference, it might be useful to talk a little bit about the inputs, so where we started and what we brought together at the start of PathSafe, and the outcomes, what we were kind of hoping to flow from the work that we've taken. These are the various inputs that the theory of change identified and highlighted that we would be bringing together. And in isolation, I mean, a lot of this looks slightly obvious, I would say. We need staff time, we need laboratory space, we need reagents, in order to do the science that we want to do. But the critical thing to PathSafe really is collaboration. That's been at the heart of everything we've done. So we've drawn together staff, labs, equipment, expertise from multiple partners to achieve more together than we could have done individually. So, for example, I know that in some of the projects, we've had partners that work really hard to find the laboratory space within their organization or with contractors or with collaborators to deliver these really ambitious research projects that we've taken. Similarly, thinking about sampling, obviously within the program, we've taken hundreds of new samples ourselves to address various questions. We've also collaborated with and engaged with existing sampling infrastructures and projects that are already taking samples to add value to those existing sampling networks that we have and draw new information from them, additional analyses. So having drawn all of these inputs together to form a program, it gives us a little bit of insight into the overall scale of collaboration that is required for the Biosurveillance network. In two kind of terms, really. One, in terms of the scale of funding and resource required. We know how much the PathSafe has cost, and we're going to how much we've got for the next tranche of the program. But that gives us an idea about how much it would cost to take some of these activities, and also the amount of cross-government coordination required to draw together departments to work. This was what we started with, and here are the outcomes that we were hoping to achieve in the kind of medium term. Again, if you want to see more detail, feel free to have a look closer. But what I think this graphic really nicely illustrates is that a lot of these outcomes that we were hoping to achieve, we've got multiple different work streams contributing to, and we're drawing evidence from different parts of the program to outcomes. Run through them all now, but I think they could probably broadly be grouped into things like data sharing. That's something that some people might generating evidence or methods to support risk assessments, for example, around source attribution, enhancing our knowledge of how to expand or enhance surveillance, including on-site testing, and also bringing together stakeholders and end users to use the evidence that we've generated across the program to inform policy and other decisions, especially in the One Health way. So work that's been done and the evidence that's been generated is going to be taken forward by the various different partners who need particular areas of focus, and hopefully that will inform some decision making. A few kind of concrete examples of that. Thinking about workstream 2 projects, so the surveillance pilot projects that have been focused on AMR. Most of those can be drawn together into the VARS report at the end of, towards the end of this year, I think, and that will inform kind of decision making at BMD about potentially what targets might be taken forward, surveillance and what might not be. We've also generated evidence about things like methodologies, application of high-throughput sequencing, and other novel surveillance approaches that we might incorporate into routine surveillance. Think about on-site diagnostics. Some of the work in workstream 3 is going to form a report that will be used by decision makers in various departments like FSA, make decisions about how on-site testing could potentially be used as part of the biosurveillance landscape, particularly, for example, at borders. Wastewater is another example, something that is a lot of the work within PathSafe is focused on wastewater testing, and that's a great interest to stakeholders beyond the PathSafe program as well. And there are decisions being made around the 4 nations about how we might take wastewater testing forwards and how that might be part of the biosurveillance landscape. And the evidence that's been generated within PathSafe across the 4 nations, looking at different targets and for different purposes, could be used to inform those decisions. And the other point I was going to make is around data sharing. Kind of a thorny issue and something that the workstream 1 system has worked really hard, I think. And if that workstream 1 system is taken forward and used kind of broadly across government departments, that would be a really great example of utility and benefit of data sharing. And PathSafe is part of these conversations about data sharing. For example, conversation that is done by Cabinet Office and by data working with PathSafe as part of those discussions and expert knowledge. So that's a kind of whistle-stop tour of where we started and what we hope we achieve. And when you look at the talks throughout the rest of the conference, you can think about some of this, how the work that's been done slots into that. The final thing I wanted to talk about was the continuation. Obviously, now we've had the great news that we are continuing for another year, so I don't have to talk about this all hypothetically anymore. But when we move into the next year of the programme, we're going to shift slightly from a full work stream structure to a theme structure, just to group some of the projects that we've got slightly differently and more sensibly for the final year. But those themes will be a data sharing and analysis theme, so this will be the work stream 1 system, adding additional functionality on top of what's already being generated. Foodborne disease theme, so that will be additional surveillance pilots and additional extension of some of the models that have been created in the first tranche and plateau. An AMR theme, so this would focus on looking at novel surveillance methods and also sources of AMR that we didn't look at in the first of the project. And finally, an on-site diagnostics theme, where we'll be developing a framework deployment of on-site diagnostics foodborne testing. That is a very kind of high-level summary of the continuation funding. I think at that point, I will say thank you very much, everybody, and pass on to the next speaker.
Great, that's a great overview. As I said previously, we'll hold questions till the end of this. Just before I hand over to Georgina, I'm going to do a quick plea actually with that overview Ed's ringing in your mind. As we go forward into this next year continuation, it's going to be really critical for us to really examples and also any hurdles. So the data sharing that Ed mentioned, we know is a huge problem right across government. PathSafe is a great example of how we might fix it, but also of hurdles. So the more of those you come across, please do let me know. I'm happy to take those conversations on. And lastly, in terms of kind of having this dialogue across wider government for a sort of longevity of the programme, really, really good examples of what worked well and actually what didn't are really useful. So if you have a bit of data that is just fantastic, please let me know. If you have a bit of data that demonstrates that we should have done it in the first place, that's also fine. We're not expected to deliver brilliantly on every single project, but the more examples we have those, the better in terms of getting real long-term legacy for PathSafe. Right, I'm going to get off my hobby horse. I'm going to hand over to Georgina next. Thank you very much.
Cool. Thank you for inviting me to speak. Morning, everyone. I'm going to be talking about the PathSafe Workstream 1A data platform efforts and really about the development of a national foodborne disease genomic data platform. I'm Georgina Lewis-Hoodhouse. I'm a digital epidemiologist with the Centre of Genomic Pathogen Surveillance and Digital Epidemiology Services. So an overview of the project and the platform itself. The aim is really to provide easy to run, comparable, most importantly, genomic analysis linked to minimal contextual data across multiple agencies with an initial focus on salmonella. The key benefits of the platform really are rapid analysis, cluster identification, multiple agency communication, and standardized pipelines, all wrapped up in an easy-to-use interface. The timelines really of the project, there were 2 discovery efforts across 2022. The first one, a broad overview of the general infrastructure of foodborne disease across the UK, and then really a focus in on salmonella as our exemplar pathogen and proof of concept. And the delivery of the actual consortium efforts and platform development have been occurring from January 2023 until the end of March next month. I guess that changes with the continuation bit. So the consortium has been kind of split into 4 work packages, ranging from project management and administration to the implementation of actually what's been decided, the community expertise. So we're not trying to reinvent the wheel, we're trying to pull together experts across various different sectors, and advisory groups to ensure that we're doing our due diligence when we're making these decisions and implementing tools within the platform. And this is to really ensure that we're not reinventing the wheel. We're learning from the community and we're implementing what's already been proven in infrastructure, with particular focus on what was proven to work with the UK. So introducing some of our consortium partners. So Climate Big Data are an integral part of the platform development. They were established in 2014, and they are a proven cloud infrastructure which is dedicated to microbial big data analysis and was heavily utilized as the key infrastructure within Corp UK. And that is something that we're utilizing within the Parsec data platform. Other consortium partners include Interabase and Foodborne LST. Both of them are kind of well-known community resources with years of expertise within pathogen genomics, but particularly with salmonella. And so we're utilizing that expertise to develop our platform. So Interabase have conducted assembly pipeline comparisons and did an extensive assessment of different genome assembly pipelines for Illumina short-read sequencing, which has then been put to our technical advisory group and then been signed off by the Parsec governance. And Foodborne LST are also a well-known resource, provide kind of gold standard typing for CGM LST and MLST. And again, we're utilizing the development team to ensure that API utility is maximized both for Interabase and Foodborne LST. And also they've helped to validate the profile assignments within the platform. So each step we're validating with those community resources. In addition to those kind of community resources, we have also engaged with a variety of different stakeholders and experts across the different sectors. The first kind of group is our exemplar end user group. And we have representatives from a variety of different agencies, ranging from the agencies that tend to focus more on the sequencing and the general surveillance to more policy-focused agencies. And you can see that we have 5 logos at the bottom, and these represent the 5 organisations that are our core exemplar end user group. And we have had other organisations be part of some of the conversations, but we've really engaged with those 4 or 5. And the aim really was to understand actually what is useful for users within these kind of operational focused discussions around pathogen genomics. Obviously, we have very good resource for research focused pathogen genomics, but what is actually needed for that easy to use operational interface. And we met regularly with these end users, gathering information on risk factors, so which analytics need to be implemented within the platform to be useful, things like metadata requirements, both on a user focused level and also an organization focused level. So what in terms of policy can be shared and should be shared? What should we be working towards in terms of metadata shared within this closed platform? And things like user personas, who it might well interact with the platform, who do we need to account for when we're developing and designing the user interface and the infrastructure for behind the platform. At the moment, our end users are really in a testing phase. So our testing phase actually runs until the end of February, and we're gathering feedback on the user interface and the analytics within the platform itself. And we're really engaging with them in terms of designing the platform so it's actually providing value to those users. And our community input advisory groups, so these are where we're getting kind of a variety of topics covered by our advisors, and membership of that group consists of people from public health, from academia, across multiple sectors. And our technical advisory group is chaired by Tim Dorman, and really they're focused on specific risk markers and tools, and best practice recommendations for analytics, in particular for salmonella. Our AMR advisory group, chaired by Kat Holt, really focused in on actual what are those mechanisms that we need to be reporting, and really which tool should be used as part of that comparable analysis pipeline. Our foodborne disease data standards group is chaired by Tom Connon and really focusing on those metadata requirements, what data standards we need to be implementing, and particularly what do we need to put into place in regards to the future aims of accreditation of the pipeline. And then our International Interaction Advisory Group. So this is key to understand what's being done internationally, who's been doing it internationally, and how we can learn from them. So we have a huge variety of people on that advisory group, and they've been presenting use cases and their learnings from what they've been doing in their own countries. And this includes representatives from like Genome Tracker, etc. And really, we want to learn from them, but more importantly, we want to align with them so that we're not incompatible with the rest of the world with what we've designed. So the output of these advisory groups is obviously the development of the platform and the recommendations for the platform, but it's also a white paper documenting those discussions and what those best practice recommendations are. So onto the platform itself. So it can really be split into three parts: the sequencing upload, the secure S3 bucket where the genomes come in, and then the analysis of those genomes. So the idea is that decentralized sequencing labs can upload their data into a centralized system, and that centralized system can assemble the genomes and then feed them into an analytical pipeline, which then shows visual reports to our end users. So data comes in, they get a new ID generated to ensure that we're, again, providing anonymized data through the pipeline. And also, users will only get a secure login and user authentication via the Climb BRIN system. Those genomes will be assembled using eToki, because that came out as our kind of recommended assembly pipeline of choice, and then run through the standard pipelines, and I'll give details of that in a moment. Those assembled genomes will be run through the analysis, and then the reporting comes out at either a single genome report or looking at multiple genomes in a view. And the idea is that end users will be able to look at these results interactively. They'll be able to identify clusters of interest and link those genomic analysis with minimal associated data. So this is where the conversation about metadata and data sharing come into play, looking at kind of our minimal information that's needed in order to provide some context and some value to those genomic analysis. Things such as time, place, mechanism, sample type, etc. When I'm talking about metadata in terms of time, for example, we started the process by aiming for a sample date or receipt date, but in the process of discussing with our end users, we know that in some circumstances, we need to reduce that level of granularity to year. So when we're talking about metadata, we've had to make some concessions in terms of detail in order to allow users to upload data to the platform, begin that conversation about data sharing. So a bit more detail about the Climb Trusted Research Environment. As many of you may be aware, they were integral to the Talk UK efforts, and they are a proven infrastructure, which is why we've utilised that infrastructure for the PathSafe programme. And more importantly, it's completely scalable. So as you can see by the numbers, they process 3.5 million genomes for Talk UK, and with a continuation bid now confirmed, and our aims to roll out further additional analytics and pathogens, the setup of the platform will be able to handle that. Then the pathogen watch kind of infrastructure. So the idea is that sequences come in, they get speciated, obviously with PathSafe iteration 1. The idea is that we're focusing on Salmonella. And Salmonella specific analytics and containers are run. And the list of analytics that we're actually implementing for Salmonella are serotyping, MLST, CDMLST, clustering, AMR, and tree building. And for each of these steps, we've been conducting validation, and we've gathered a variety of different validation data sets, ranging from historical data from our end users to the EURL Salmonella reference data set. So we're gathering a variety of different data sets in order to validate our decision making and validate the tools that we've been implementing. And all of these analytics are then fed into reports that are user focused and friendly. So we've been working with our end user group in order to provide those intuitive reports that they can use, ranging from information about single genomes all the way to kind of population. So onto the user interface. So this is a simulated data set that we've been using for our user testing. This is kind of our set of panels that we think that users will want to use. And information within the platform is organized in 3 ways. So we have folders, which is the list of genomes coming in. That's where our genomes get stored and organized. Then we've got views, and these are dynamic collections of genomes that allow you to look at what's coming into the platform in real time. So the views are likely to change. And this is representing a view. So I haven't set any filters on this at the moment. It's everything that's been uploaded in the simulated data set. But the idea is that you could look at a snapshot of 2 weeks, for example. So everything that's come into the platform over the last 2 weeks. You can also apply filters based on the organization that you're interested in, etc. And the panels really go, so on the far left, there is a context panel, far left, as you guys are looking at it. The context panel, so this is where you can begin to look at your genomes in the context of everything else that's been uploaded. And you can compare what you've got with other publicly available data. In the middle is our tree panel, and I've applied the color as I was really interested in the source type, but you can edit that as much as you want, depending on what you're interested in. So you can look at particular patterns of resistance, if that's what you're particularly interested in. Then we've got the map panel. So geography is quite important when looking at genomes. So it allows you to overlay that interactive tree with map information. And you can see that we've got some genomes and samples coming from Oxford and from London. And all of this is simulated data. We just decided we'd give Oxford loads of salmonella. As you can see, there's a lot going on in this view, and the reason is we want people to be able to explore their own way. So we've allowed for a variety of different filters. With the context search, you can do it by location, so you can really limit if you're particularly interested in if there's something linked to your genomes across Europe, for example, or you're particularly interested in the US. You can limit your context search by that. You can also look at different time periods. So if you're only interested in what's happening over the last 6 months, you can then look at the context over the last 6 months. And then along the bottom, you can see our metadata table, and there are tabs along the side, and this contains the outputs of the analytics. You can again look at all of these genomes and look at what the outputs of the analytics are. So you can look at the pattern of antibiotic resistance, inferred antibiotic resistance, if you'd like to. So moving on to the single genome report. So this is where really you can focus in. If there is a particular isolate that really you want to communicate about, or you want to discuss with colleagues, both internally or externally, you can look at the single genome report, and this contains all of the outputs of the analytics. It contains your metadata, and you can see, for example, the AMR of this particular isolate. There's inferred ciprofloxacin resistance. Should have chosen an easier one to say. Also, assembly stats. So if you want to have the conversation with the bioinformaticians, you can then discuss the assembly stats of that particular isolate. Now, you might not be interested in just looking at the single isolate. So the third level of information within the class data platform is a snapshot. And this is where you create a static view of that collection. So I've identified a cluster of interest that I particularly want to investigate. I've created a snapshot looking at that cluster of interest, and then I've run the clustering again. So I want to know particularly with that cluster of interest, what else is out there. And in the tree panel, you can see a series of circles and squares. The circles are the genomes that are part of my cluster of interest, and the squares are everything that's been brought in as part of the context search. And you can see on the map, it's suddenly zoomed out. We're no longer just in Oxford and London. And you can see that actually there's a spread quite wide of genomes that are linked to the cluster of interest that I'm particularly interested in. And again, with that context search, I didn't add any parameters. So on the tree, you can see that actually there's a whole load of blocks down the side of the tree, and that's where I've added metadata blocks. So this is where I can begin to overlay some of the metadata or results of the analysis with the genomic information contained within the tree. So I've just chosen an arbitrary number of metadata blocks, but you can add as many as you want. And this is where you can begin to look at those patterns. So you can look to see whether there's a pattern within your data that is linked to your cluster of interest. Is there anything that suggests that needs further investigation? And down the right, you can see the legend. So you can again look at various different color schemes to see the information you're showing. So kind of that was a whistle-stop tour, an overview then. So already been mentioned multiple times is kind of data sharing and data release. So a key challenge of the Workstream 1A data platform has been working with the various different organizations and working within the constraints of their policy. So data sharing policy is kind of, I think at the moment, a hot topic and a real key challenge. So within our platform development, considering the time constraints, we've had to work with quite limited metadata moving forward. We would like to work towards kind of getting more level of detail within that metadata. Standardization as well. So genomes are comparable if you run them through a standardized analytical pipeline. Now, we're not suggesting to every organization that they need to change their own infrastructure and change their own pipelines. You've all got accredited pipelines, and that's great. What we want to do is to allow an easy to run pipeline that can then compare genomes. We're not trying to replace, we're trying to enhance. Policy and governance going forward. Now, this is maybe slightly easier with the continuation bid now being agreed, but who owns the platform? How does this move forward? And who is in control of the governance? And then measuring impact and value provided. So platforms can really only be measured in terms of impact once they're used. So within the time constraints of January to this March, we've not really been able to measure the impact of the platform. This can only be done post-March once it's rolled out. And so actually setting up that system for measuring that impact is key for us to move forward. So I've kind of gone on a little bit into what's next. So we want to build trust in the platform. We want to get users using it with the level of detail we have. And by increasing that level of trust, we are hoping to then get a higher level of detail in terms of metadata coming in and get more users onboarded into the platform. So increasing the level of data uploaded to the platform, both in terms of numbers and granularity. We also want to measure that impact. We want to work with the organizations to ensure that what we're doing is adding value rather than adding kind of stress and more work to be done. I guess the last 2 points are slightly continuation bit. We're hoping that that's successful. And this is aiming to scale up to additional pathogens and also continue to develop the Salmonella pipeline. The idea is that we will scale to E. coli as the next pathogen priority. And then depending on the bid, we will either add Campylobacter or Listeria as kind of pathogens of priority. And with that, I will go to my acknowledgements. We've talked to a huge number of people, various stakeholders. We've had engagement across the globe. And really, that engagement has allowed us to get where we are today. Our end user group leads I've listed here from a variety of different agencies, but we've also spoken to sequence providers, etc. Special thanks to the PathSafe program team and our chairs and our consortium leads. With that, I'll hand over.
Thank you very much, Georgina. So hold your questions and brew more for Georgina because I'll be getting it in a few minutes. And we'll move on now to Elisa, who is going to talk about work stream 4, which is the program on AMR, which you might hear about. And then we'll take questions on both of those together at the end for the break. So here you are. Over to you.
To be longer than I thought it up here. All right, so my name is Elisa. I'm a product manager in UKHSA, and I'll be giving a talk on the work that we did for workstream 4 in developing an exemplar One Health data system for pilot environmental AMR surveillance. All right, so the main aim of workstream 4 was to pilot environmental AMR surveillance methods, and my team's involvement in that was in developing an IT exemplar system that would ingest, analyze, and report the data generated by that pilot, and also to conduct an initial discovery into the target vision and feasibility of creating a UK One Health surveillance system in practice. And we did this using an agile framework. For those of you that are familiar with this, it consists of usually 4 phases: a discovery phase, alpha, beta, and light phase. And the work was done by Deloitte, who was commissioned to do the work by UKHSA. So most of the talk will focus on the discovery elements of this work, and there's a poster which you can look at, which focuses more on the alpha, beta, and light phase. So how did we do this? Before the discovery phase, something that we did was to have an initial thought on the kind of questions and strategic objectives that one system need to meet. And during that, we identified 6 strategy objectives, which we're calling epics. And these objectives were really around for each source, knowing for each source what resistance is present in what organisms, what was the level of antimicrobial resistance, level of resistance, what is the context of resistance, how is resistance distributed, what is the risk of resistance, how is the resistance investigated and acted on. Now, knowing these epics, these strategic objectives that the system should want to meet, what we did next were to engage with potential users of a One Health surveillance system. And as you can see from the screen, we engaged a lot of individuals from a wide background. And this included people from the academia, the academic sector, the world administration, governmental agencies. And what we did was to group them into 3 main groups. So those that provided data, those that processed data, and those that consumed or used data. As you can imagine, some of those user groups would fall into more of these categories. A lot of the data providers, also data processors, etc. Once we mapped our user groups, we then conducted a user story building exercise. And we did 2 of these actually. One for a One Health surveillance system, and one for the exemplar that we're trying to build. And by user story, what we mean by this is specific objectives that we would want the system to meet, which will be in line with the overall strategic objective. Now, what we asked users to do during these workshops were to think about what user stories they would find relevant within their groups. And once they've done that, rank those in terms of priority with a simple low, medium to high priority order. Now, after we did this, found out that we're able to get about 90 user stories across all the user groups that we engaged with, and about 63 user stories for the exemplar. So sorry, 90 user stories for the One Health surveillance system, and about 60 for the environmental surveillance system. As you can see from the screen, we had a wide range of engagement from different user groups. So that's good because we've got inputs from a wide range of potential users. Now, what I'd like to show you here is the user story prioritization metrics. Now, without looking at the specific user story prioritization list here, what I would like you to take away from this is the fact that most of the user stories that were identified are ranked either high or medium priority, and most of the user stories seem to fall within the strategic objective, or at least what our users felt should be the strategic objectives, to be around the level of resistance, knowing what the level of resistance was, knowing what was the risk of resistance, the risk to resistance, and also knowing if the resistance has been investigated and acted upon. And something of interest to note is that once we collected all the user stories, we went able to map anyone to the third epic, which is the context of resistance. And in addition to that, there were some other user stories which didn't map as exactly to the other epics. So a new epic had to be created for that. This had to do with user stories that are around the processes and governance. Now, once we had prioritized all the user stories, the next thing we did was to conduct a data maturity assessment. And what this was in summary was just trying to look at the user stories that they have listed and ranked, and just assess if the data required to realize those user stories are available, accessible, or even suitable. And we did that, broadly speaking, by just comparing it against these four pillars we have in the screen. So each of the user stories were broken down and compared for whether the data required to support them were complete, whether they were accurate, and whether they were accessible. Automation is one that wasn't looked at in detail during this initial discovery, but definitely something that would need to be looked at further when the discovery will be done. So what are the summary findings that we got from the engagements? So in brief, or in summary, we found that users across the different user groups that we looked at were interested in being able to monitor the thresholds and to apply thresholds and benchmarks, be able to know what the source and flow of AMR through how AMR flows through the ecosystem. They were interested in knowing what the governance and data access and sharing processes will be. So ensuring that there was accountability in how this data was being shared and used. A very important one that we found was that a lot of users were interested in the outcome of the system being used mostly for policy and not just for practice. So once you have the survey system, once you use it, just to make sure that something actually comes out of that rather than just going. And then there are the technical considerations of what the system should be able to do, things like the system being as agnostic as possible, being able to be future-proof, being able to be flexible, being able to link to other databases that you would need to contextualize the data. Now, something as we mentioned earlier is that we engage with developed demonstrations, which you can imagine is an important aspect of the work, considering that this is something that is being done as a contribution to the world on the UK-wide governance of the system. And what we found during that engagement were that most of the things that the user group, well, representative of those different organizations we are interested that we make sure we consider things around the operational aspects of the system. So making sure that the system is able to handle the differences across different administration, differences such as maybe differences in data quality, differences in sampling techniques, differences in how the data is available and made available and also analyzed as well. And also they wanted the system to be able to account for a way that it will be able to present the data and the findings from the system in a way that would be flexible and also different because of the different user groups. So what were the challenges that we saw, or at least the anticipated challenges that user groups we engage with or that we would encounter? Most of them were around technical and operational considerations. So operational considerations, just being able to implement such a surveillance that has such a wide scope of different sources of AML. Communication across different organizations, make sure those are all joined up, and then being able to actually interpret the data that we are seeing in a meaningful way across different sources, and also accounting for the differences that, well, how differently you have to interpret the data when they come from different sources as well. Then there are technical considerations which you can imagine when you're dealing with such a complex system. So it's anticipated that there will be challenges linking large data systems, challenges around data sharing agreements, which at the moment across all the different sources of surveillance, there's not a lot of that would need to be. And just the frequency and availability of the data sets that will be needed for this system. So what I would like to just show you next is just a little bit about the system. The final solution was actually developed from findings from the discovery, and that is the exemplar system, environmental surveillance system. The environmental surveillance system, as I mentioned, is an exemplar of what surveillance system being proposed to look like. It is limited in scope in terms of the data that it is analyzing and reporting and what it does. So as you will see later, the pilots environmental surveillance has limited scope. It is covering 3 river catchment areas and resistance in the environment. And this exemplar system was designed to complement that, to be able to report that were analyzed and report back findings from the data generated from that surveillance. So what we'll have here on the screen is the high-level design architecture that was proposed during the discovery phase and what was used to develop a low-level design architecture and eventual IT solution. And in brief, how it works is that the data is supplied from the different partner organizations and it is uploaded into AWS buckets. And the kind of data that we're talking about is data from the reference laboratory, so antimicrobial stability data, substance concentration data from EA, so things like levels, pregnant levels, etc. Even metagenomic data for control distributors. All these were uploaded to AWS buckets automatically, and when it gets to the AWS buckets, there are AWS Lambda functions that automatically gets triggered and goes through and takes the data from there through data validation. Depending on the outcome of the data validation, the files get saved in different locations. File data validation goes to one side, those that fail go to another side for the validation. And then when that is done, Amazon Redshift is used for the data aggregation and data analysis, and then finally the information is passed to Power BI, which is what's used. This is a very high level overview of the time, and it's worth mentioning that most of the technologies that was used for this, the decision to use them were made based on need to take advantage of the existing technology that we had in UKHSA. But the design has been done in such a way that these could be swapped. So it doesn't specifically have to be Power BI. You could use Tableau, for example, and keep the low level. And just want to mention that when we were designing the system, we had these 6 personas in mind. The core users that will be system, there's data scientists, supporting engineers, but like their specialists and the way they will interact with the system will be different, their needs for the system different, and how they interpret the data will be different. And we had that in mind when we are designing some of the. So as I mentioned earlier, the development of the system was done. It's an agile framework. Talk a little bit about the results during the alpha phase, where we took the findings that we discovered, things like what the user needs, what they thought the system should do, the anticipated challenges, things like that. And then we use them to first of all build the personas that I showed you, and then build a basic cloud-based data. And then we developed wireframes and basic dashboard designs. And by wireframes, we mean just mock-ups of what the dashboards will look like, what the dashboards will look like, what the reports will look like. And then based on that, we got final feedback before we moved into the beta phase, where the reviewed designs and refined designs eventually built. Then they were built, we tested the data injection and validation of the data. And then once after that, then we moved to where there are further refinements, there were some additional functions. I remember that that it was determined it was going to be needed, and then they were built. So consequence of time that we have left, move to the actual screens of the system. So what I have in the next set of slides are just screenshots of the system. Just want to take you through what they actually look like. So first off, we have the home page here, which shows you just to give you a quick about the system, include what it does, what it includes, what it does, user guides, updates, things like that. And then the next page is a report explanation page, which we built, and this was something that came directly from the feedback that we were getting from users in terms of want to be able to know what the system does anyway when you arrive at system really. So it's an interactive dashboard that suggests different reports that are available based on keywords of interest that you would. And then we have a data health page, which just shows you all the data sets available in the system, status, when they've been updated, and I can provide them. And then I'll use this page to explain the key features of most of the dashboards that are repeated in the others. So most of the dashboards, they all allow you to look at the metadata that was collected from different samples. So things like geospatial information, you see a map to the left, which you can actually zoom in and out to and go to specific cases. And then you have a trend of bacterial prevalence for this particular dashboard. And for each of the dashboards, there is the corresponding record level data below. And then you have some other things like the total samples, sample date, catchment areas, just to give you that contextual information. And then there's a similar dashboard for prevalence, similar information as well. So I'll just keep that. And then we have a dashboard for showing antimicrobial resistance. So for all the samples that are collected, circulating data was determined for them, and there's different system with that what it shows. And then the next dashboard is the MIC distribution report. So for the antimicrobial stability result that you see, you have this report that shows the distribution of MIC, which is minimum inhibitory concentration, the minimum level to which microbial groups work. And then something that is worth noting here is that for this dashboard, because of the need to understand different interpretations, there is something that is introduced called a standard, because there are different ways you can view antibiotic susceptibility. You could use different definitions. So it was built into this dashboard that you could actually use different interpretations to view the report by, for example, UCAS definition, ECOG file types, etc. And then there was another dashboard that shows the substance concentration in the sample, things like cells,
Leave it for now.
and then we also have some genomic data, particular is AMR gene presence in each of the sample by again all the different metadata available, geospatial, etc. So let me go to the summary of this. So in summary, we developed recommendations and a strategic case for the development of a UK-wide 1L surveillance system. We developed the exemplar, as you've just seen, based and heavily influenced and heavily directed by the feedback we got during the discovery phase. And then some of the learnings that we had from this process was that the choice of visualization tool can limit the desired functionalities. There are some purpose of functionalities during the discovery phase which we could not implement because of the visualization tool that we've selected, unfortunately. And then the timely availability of the data can be an issue, something that would really require dedicated resources if this was being upscaled to a 1L surveillance system. And then things like tech stack and governance approvals, this need to be arranged in time ahead of the development phase, which we found was very important. And then a key stakeholder feedback that we got during the entire process was that, it's not just about collecting the data, and this always stayed with me. It's not all about collecting the data. It's not all about building systems. What do you use the data to do when you have it? How do you interpret it? How do you translate this into action? I think that leads nicely into what we think should be the next focus of the work, which is to do some more work and research into how you interpret these signals that you find from such a system and how you can use those systems to inform what the next appropriate action should be. And that's it.